Bartholin's cyst. Also known as Bartholin's cyst, is a common condition that affects the Bartholin's gland, which are located on either side of the vaginal opening. These glands are responsible for providing and producing lubrication to keep the vaginal area moist. Bartholin's cyst is a fluid-filled sac that develops when the ducts of the Bartholin's glands becomes blocked. The cyst typically forms on one side of the vaginal opening and can range in size from a small pea to a larger marble. In most cases, Bartholin's cysts are painless and may go unnoticed. However, if the cyst becomes infected, it can lead to discomfort and pains. The exact cause of Bartholin's cyst is unknown, but several factors can contribute to their development. The most common cause of Bartholin's cyst is a blockage or obstruction of the ducts that carries the glandular secretions to the vaginal opening. This blockage can occur due to several reasons, such as thickening of the mucus, infection, inflammation or trauma to the area. If a blockage occurs, bacteria can multiply within the blocked gland, leading to an infected Bartholin's cyst. Infections are more likely to occur in sexually active women, as sexually transmitted infections can increase the risk of cyst infection. Fluctuations in hormone levels, such as those that occur during the menstrual cycle, pregnancy or menopause, can contribute to the development of Bartholin's cyst. Bartholin's cyst may or may not cause symptoms. However, when symptoms are present, they include a painless lump or swelling near the vaginal opening, discomfort or pressure in the vaginal area, especially when walking or sitting, redness and tenderness around the cysts, discharge from the cyst if it becomes infected, and pain or discomfort during sexual intercourse. Diagnosing Bartholin's cyst typically involves a physical examination by a healthcare provider. The healthcare provider will visually examine the affected area to assess the size, location, and appearance of the cyst. The provider may gently feel the cyst to evaluate its consistency and tenderness. In some cases, additional tests such as an ultrasound scan or imaging studies may be performed to confirm the diagnosis or to rule out other conditions. The treatment of Bartholin's cyst depends on the size of the cyst, the presence of symptoms, and whether or not it is infected. Applying a warm compress to the cysts can help promote drainage and relieve discomfort. This can be done several times a day for around 10 to 15 minutes each time. Soaking the affected area in a warm cyst bath can help reduce swelling and promote drainage. A cyst bath involves sitting in a few inches of warm water for about 10 to 15 minutes each day. If the cyst becomes infected or causes significant discomfort, a healthcare provider may need to drain the fluid from the cyst using a procedure called incision and drainage. This procedure is typically performed under local anesthesia. If the cyst becomes infected, antibiotics might be prescribed to treat the infection. In some cases, a surgical procedure called marsupialization might be recommended. During this procedure, the cyst is opened and the edges are stitched to create a small opening that allows ongoing drainage, reducing the risk of further cyst formation. Most Bartholin's cysts can be effectively treated without long-term complications. However, complications can occur, particularly if the cyst becomes infected. Complications might include the formation of an abscess, which is a collection of pus, or the development of a recurrent cyst. Recurrent cysts may require further evaluation and treatment options such as gland removal or other surgical interventions. As we conclude this segment, it's important to understand that Bartholin's cyst is a common condition that can cause a painless lump or swelling near the vaginal opening. Although most cysts are harmless, they can become infected and cause discomfort. Understanding the causes, the symptoms, diagnosis, and treatment options for Bartholin's cysts is important for women's health. Prompt medical attention and appropriate treatment can help alleviate symptoms, prevent complications, and minimize the risk of recurrence.